I know we don't have, I know we don't have quite a large group yet, but I bet people are just coming in from their gardens. It is an absolutely stunning spring day today, and I honor everybody to enjoy the weather. But tonight we're going to be talking about a Massachusetts bill that would bring Medicare for all to our wonderful Commonwealth. Thank you, Jen. So my name is Ellen Church. For those of you who don't know me, I'm a member of the League of Women Voters chapter of Acton area, which encompasses several towns in the Metro West area, including my town, Hudson, Massachusetts, a town of 20,000 people, which is bordered by Marlborough, Stowe, Sudbury, Bolton, and Berlin. If you haven't heard of some of those towns, you're not alone. I never knew about them before I moved here. I mean, I knew about Sudbury, but that's pretty much it in Marlborough. Medicare for all is very, very important for all of us to be aware of. So we're going to dive deep into it today. You can go to the next slide. Okay, just again, I am the Legislative Action Committee Specialist for Healthcare. I have a sidekick, but I am the one covering the Medicare for All bill, which has a large coalition, as Barbara alluded to earlier. I am one of 20 specialists who drive advocacy work at the Massachusetts State House. We collectively, as you can see here, we monitor many bills in 20 broad areas, including some examples are PFAS and environmental bills. Another example is gun legislation, gun control legislation. Every year, every 2 year, every session, we submit written testimony or present oral testimony. And this year, it's going to be a lot easier and better to submit oral testimony through Microsoft Teams. So we're looking forward to that. And we suggest advocacy actions that local leagues and at-large members can take, and individual members can take. And you can pass on to your networks anywhere in the Commonwealth where there's a stakeholder interested in the success of the bill. We do have educational events like the one you're attending this evening and other events. I believe there was Representative Lovely. Do I have that right, Jen? Representative Lovely? I don't know if you're on mute, but anyhow, we have
Sorry,
an education.
Senators. Yes, Senator Lovely. Yes.
Senator Lovely recently presented to our group. Unfortunately, I could not attend about the legislative process. And we are guided by LWVMA's program priorities set by convention. Next slide. So I did not pick this bill. I came in after it was already picked, but the way that it's picked is defined by whether League of Women Voters of the United States and our Commonwealth League of Women Voters have a position to support or oppose. We also look at whether it has broad policy implications. Does it have support from coalition partners? My bill absolutely does. It has a very large coalition. And also, can the League of Women Voters of Massachusetts move the needle by adding our name as a supporter? What kind of obligation do we have, and what's the likelihood of passage? And also, do we have people power? Next slide. As you can see from this screenshot, this is from our League of Women Voters in Massachusetts website. Under advocacy tab at the top menu, you can see our supported and opposed legislation for the League of Women Voters in Massachusetts for this legislative session that began in the beginning of 2025. I am not going to go through this. Please visit it at your leisure. This 2024 to 26 impact on issues is our guide to public policy positions. And I think it's just, everyone kind of knows about that if you're part of the league. And if you don't, you can check out the website. This is our local, not local, our statewide Where We Stand program book. It is, as you can see, organized. If you can see, I don't know how well you can see, but it has it organized by topic. And as I mentioned, handgun control has a section, and it talks about, why the league is supporting it and what it is. And then, as you can see in the bottom right, there's a healthcare section. And it's not possible to read it, but if you haven't had a chance, you can get that easily from our website. Next slide. So what do we do and when do we do it? There's as somewhere on one of these slides, it says it's a marathon, not a race. So sometimes we have to pause, sometimes we have to read. We do a lot of reading. I'm going to start with the bottom bullet first. We follow and monitor the legislature continuously through tools like Mass Track, the State House News Service, which is excellent, the Commonwealth Beacon, everyone knows the Boston Globe, and of course, social media. So that's most of what we're doing on a day in and day out basis, monitoring what's happening. For my bill, there was quite a lot happening last year because of the Steward Healthcare debacle. But backing up to the top bullet, we do select bills for the new session, January through May 2025. Today, I'm only going to be talking about Medicare for All bill, but there is another companion bill that I will allude to later. We do write and submit testimony from about starting tomorrow, all the way all summer and through September. We at the LAC issues action alerts closer towards the end of the session when there's going to be votes coming up usually. And we often will engage members to encourage their legislators to co-sponsor legislation. Because when you call your legislator or write to them as a constituent, they are more likely to listen to you. And with statewide bills like mine, we really, really need a wide breadth of support across the state for us to gain traction. As you can see, there's a period of April through June where there's outside section amendments to the budget. We don't normally get involved deeply in the budget, and I'll just leave it there for now. If you have questions, you can contact the LAC folks that could better answer the question than I can right now. Next slide. So as I mentioned a moment ago, we want our legislators to co-sponsor. So for example, my own representative, Kate Hogan, does not co-sponsor my bill. I have asked her to. I have told her why it's a great idea, and I'll leave it there. We ask them to vote favorably out of the first committee. In my case, it's healthcare financing. Vote favorably out of the second committee, bring the bill to a floor vote, and of course, vote yes when it comes time to vote for the bill. Next slide. All right, so let's get into it. This is an act establishing Medicare for All in Massachusetts. Before I get into all the detail of this particular bill, I'm just going to tell you something real quick. What is Medicare for All? What does it even mean? Some people think it means universal coverage, single payer, and abolishing private health insurance. Some people think it doesn't mean single payer. Some people think it only means universal coverage. But I'll tell you one thing, every definition says that it means universal coverage. You may or may not know that in Massachusetts, we have a lot of people with insurance, but that doesn't mean that when you start a new job, you have health insurance. You often will have to wait a minimum of 3 months. That's on average. And so that's called underinsured when you have gaps in your coverage over the course of any 12 months. And as you know, that can lead to penalties when you go to file your taxes. That's not even the worst problem caused by that, but that's one problem. That's a pocketbook problem. And these are people who are actively seeking work and getting jobs. So we'll leave it there. The lead sponsors of this bill, Senate Bill 860 and House Bill 1405. In the Senate, we have Jamie Eldridge. He happens to be my senator. And in the House, we have Representative Sabadosa and Representative Scarsdale. Like I said, it's arguing for universal single-payer healthcare, so definitely universal coverage. They're arguing for single payer. Now, some very high level, and I'm going to go into greater detail, but to start with, for those of you who are not familiar, it will reestablish healthcare as consumer-driven, fiscally responsible entity, okay? That means it's creating an independent consumer trust fund, and it will be funded in a way where Massachusetts consumers feel most comfortable. And what does that even mean? Next slide. All right, so let's start by talking about problems that we're trying to solve with this bill. And this is just a few of them. We have a lot of problems to solve. This bill will expand access to care. Now, just remember the two important words, access and affordability. If you remember nothing else I say tonight, those are two words I want you to remember, access and affordability. It will create stability for healthcare providers. What do I mean by that? I mean healthcare clinicians, I mean facilities, they will have steady business. And I'll get back to that one later. It takes control back from private insurance companies. So our bill absolutely will make it impossible for private insurance companies to do business, offering healthcare, health insurance in Massachusetts. So that's a big, big change. And that's a big, some people think the problem is the private health insurance companies. We'll get back to that. Again, my favorite second word is increasing affordability, okay? Cuts the ability for private equity firms and healthcare corporations to make excessive profits from selling healthcare services at unreasonable prices. I will admit that I'm doing a little editorializing here, but I will tell you that profit is not a bad word. In fact, nonprofits make a profit, but they reinvest their profits in the business to further deliver on the mission. So let's just put that in the back of our minds for now. We'll come back to that as well. Apparently, I'm coming back to quite a lot. The problem next that we're trying to solve is disrupting the pattern of underperformance of the healthcare sector to deliver its mission. I just mentioned they need to deliver a mission. The mission is provide healthcare and to do it in a way that's fair, in a way that's appropriate and accessible. So they speak your language. They're not going to send you a surprise bill. They're not going to scare you. You know, there's a lot of basic expectations for delivering healthcare that that we have in Massachusetts. We have underperformance. Okay, we have a problem. Even though we love to tell people we're an amazing place, yes, you can get amazing medical care in Massachusetts, but they could do so much more. Let's hold that there. We are also trying to solve the problem of providing all places in Massachusetts, from the tip of Cape Cod and P-Town all the way to North Adams. We want adequate healthcare facilities. We don't want any healthcare deserts. That means you have to drive an unreasonable amount of time to go seek and attain basic healthcare services. Next slide. Okay, so we talked about the problem. Now, what tool will this bill use to solve the problem? The main tool is that it creates a trust that would replace our current mix of public and private health insurance plans. And it will replace it with a universal and comprehensive healthcare plan available to every Massachusetts resident. Actually, not to confuse you, but it will even be so generous as to allow other people who are not Mass residents to participate as well. But that's for you nerds to research later. We'll also create an operating budget and a capital budget. Services rendered by physicians and other clinicians will be paid for from the operating budget. The budgets will be for institutional practitioners as well. That means people who operate the lab, people who are operating MRI machines, so techs, people who are processing blood product. So everybody who works in the hospital, who's not a clinician, they will be covered and paid for. There will be administration of the trust. So yes, there will be people doing business and there will be people managing things. That's where people get very suspicious, but put that in the parking lot for now. Now, how about capital? What does capital mean? Capital means buildings and, things you can touch, desks, chairs, keep the lights on. Okay, we will use this money in the capital budget to construct or renovate health facilities. We will also use the money in the budget for capital to pay for major equipment purchases. Just like I just mentioned, we need MRI machines. They're extraordinarily expensive. But we use them every day in medical care, okay, for diagnostic purposes. Next slide. Who is going to run this and why should we trust them? Okay, we're going to look at the healthcare trust and it will be organized in terms of personnel. Guess what? 29-member board will oversee the trust and they will hire an executive director. The executive director will go on to hire the directors of 5 divisions and execute the mission of the trust. Planning. Okay, we need to figure out where we need to build or renovate facilities. We need to plan for the workforce. We have a lot of workforce shortages in Massachusetts, especially nurses. So we need to do some planning. Information technology. These folks, I saw this and I was feeling like, wow, there's going to be a big change. They're going to be in charge of electronic medical records. Okay, that's a big change. Quality assurance. That is a whole field in itself. You can study for years and years and years about all of these topics, but quality assurance is a very interesting topic where you are trying to avoid medical errors. You're trying to make sure that nobody gets the wrong medicine. You're trying to make sure that people get appropriate care for, whatever they're dealing with in their health. Second to last is regional. So people will become experts on, say, healthcare on Cape Cod, healthcare in Greater Boston, whatever. There'll be experts on their section of Massachusetts. And lastly, administration. So making sure that everybody is carrying out the mission as intended and people are hired and fired and all the people who are working there, have everything they need to do the job. They have the right supplies. If somebody's doing the wrong thing, they have a conversation about it. Next slide. All right, so who's going to be on the board of trustees? Who are these people? Anybody know these people? I know the one on the right the best because I used to work under the Department of Public Health as an epidemiologist. This is Robbie. I'm blanking on his last name, but he's our Commissioner of Public Health. And if you can go back one, all the way on the left is Kate Walsh. She's our current Secretary of Health and Human Services. And she used to be my boss's boss when I worked at Boston Medical Center. And in the middle, I don't know this gentleman, but apparently he's the Secretary of Administration and Finance. So these are 3 of the 29 members. Other people that would be on the board would be somebody like me, an epidemiologist, and other example is health disparities experts. So who are making sure not only rich people and not only, people who are really good at asking for what they want and bullying people to give them appointments are going to get care. Everyone's going to get care. Next slide.
What the hell is that?
What are the responsibilities of the Board of Trustees? Ensuring universal access, establishing medical issue policy, population-based public health issues, research priorities. Yes, we will be doing research. The scope of services. What services are we not doing? Are we doing cosmetic surgery? I don't know, but they'll decide that. Expanding access to care. Jumping ahead, evaluating proposals for innovations in health promotion, disease and injury prevention. So are we going to be talking to people about car seats for their vehicles? Are we going to be doing how much public health and education and research and, how expansive could this be? This could be very exciting. It's very, very ambitious. I just want to point that out. This is a very ambitious bill, but it's doable. We're going to establish criteria for evaluating requests by health facilities for capital improvements. Of course, people are going to ask for money to build their new wing or, expand their emergency room if their population goes up. And those considerations will be taken up by the 29 member board if the administration and the planning office cannot handle it on their own. There's going to be a lot of discussion, a lot of decisions made. And lastly, hiring an executive director for the trust. Next slide. Who can be part of this healthcare landscape? So, of course, the people you would expect are going to be part of it. You're going to see those Newton Welsleys. You're going to see Mass General. You're going to see UMass Medical. You're going to see those big providers. But the main thing is they have to meet certain criteria. Are they licensed to operate in Massachusetts? We must require that they do not accept payment from other sources for services provided by the trust. So they must only accept payment for services by the trust. So that's an extremely big change to the way that we do business now. They must sign an agreement to not discriminate, okay? They must keep patient information completely confidential. We already have a federal law, HIPAA, for this, but this would remind everybody, you must be keeping everything confidential. No selling of the information to, third party. There's none of that. You cannot do balance billing. Who knows what that is? It's when they say we charge $100, somebody pays $70 and they send you a bill for $30. That is going to be illegal. And they must provide the trust with all reasonable information needed to make payment decisions. And lastly, they must comply with state and federal guidelines on safe staffing, quality of care, and efficient use of funds for direct patient care. Next slide. There will be, this is for you consumers out there like me who, really, really want to tear all my hair out sometimes when it comes to seeing my medical bills. There will be no deductibles. There will be no co-payments. There will be no co-insurance or other cost sharing imposed on patients. Patients will have free choice of participating for physicians and other clinicians, hospitals, inpatient facilities, and other healthcare providers. I want to reiterate, this is a sea change. We are so used to being the final person who cleans up the bill after everybody else has paid. We cannot tolerate that anymore. It's not tenable. Next slide.
There you go.
I have a note on insurance companies here. Insurance companies will be prohibited from charging premiums to eligible participants for coverage of services covered by the trust. Next slide. Proposed funding. Okay, so this will replace premiums and out-of-pocket payments. The employer payroll tax of 7.5% on W-2 wages, exempting the first $20,000 of payroll per establishment. An additional 0.5 payroll tax on W-2 wages on establishments. An additional 0.5 payroll tax on W-2 wages on establishments with 100 or more employees. You can read the rest, but basically the idea is that you are providing some of your money to go to this trust. And employers have a part to pay too. If you're self-employed, your first $20,000 of your payroll is exempt. And you pay 10% payroll tax. 10% tax on unearned income above $20,000. And of course, Social Security pensions, Social Security income, Social Security disability insurance. I'm sorry, Social Security insurance, unemployment benefits, workers' comp, sick pay, paid family and medical leave, and certain capital gains will not be taxed. Next slide. I'm going to pause here and I'd like to take a couple of questions. I only have time for about 3 because I have to go after 45 minutes. I'm sorry, I have to wrap this up pretty quickly tonight, but I'd love to take some questions that pertain to what I presented tonight. And please, I just want to put a couple things in the chat for you. The first is, I want you to see this article that was written in 2020. It's all about the national idea for single payer, and it will just help you think about all the various issues that come up. And then I'm going to share one more slide, but while I do that, I would take some questions. Any questions? I can't see any. Okay, Barbara.
Well, if anybody else has a question, they should go before me. But I was curious. I think that people get very upset when we say that there'll be no health insurance, and I think there, like in Canada, there is room for having private insurance for things that are not covered by the trust. So it's sometimes easier to tell people, well, only things that are not covered by the trust, then you can have insurance, rather than saying, we're going to just get rid of them. Although basically we're getting rid of them. You're absolutely right. Do you agree on that?
We are getting rid of them, and we are getting rid of them. And that's where that's what this bill says. And remember, just to jog your memory, the only people who were for abolishing private health insurance in let's see, as of 2019, that were thinking about running for president was Bernie Sanders and Elizabeth Warren. Andrew Yang did not support that. Buttigieg did not support that. Booker, Harris, Castro, Klobuchar, Biden, O'Rourke, none of them supported that. So this is a very, some people would say a very, radical concept. But I don't see any other way to do it. It's too political. It's too cuckoo to have the health insurance playing all this game of, okay, we'll pay this, you pay this. It's too crazy. So that's my 2 cents on that. Any other questions?
There's one in the chat. You see it?
I put that there.
Oh,
That's a link to our health safety net,
okay.
which currently helps people who can't pay at hospitals now. There is a fund, there's a trust, just like we're talking about for this bill. But of course, I bet 90% of people who need it don't even know how to access it. So it's not really doing its job. And it doesn't help people who are, especially people who are underinsured, who are in between jobs. It's just too obtuse for people. It's just not transparent, in my estimation. Anybody else have a question? Okay, so I'm just going to tell you guys a couple other things that I wanted to cover. As you can see on the slide, we are, if you could pull up the slides again, please. We are, this is not, like I said, it's a marathon, not a race. We are at this every month of the year. And I'm specifically talking about the MassCare organization, which is a very dynamic, mostly volunteer-led organization. There's one employee, the executive director, And we have smaller hubs around the state. And I serve as the league representative on the board for that organization. And we have little groups all around the state that are focused on their region. So for example, Barbara, who talked earlier, was talking about how, I don't know if you guys were here at the beginning, she was talking about getting a resolution passed for her local town. Barbara, if you want to chime in on what you were trying to accomplish in your local area.
So, well, we did that. We already we did a resolution. So that the town council voted to tell our representatives who already support it to support it, but also to tell the leadership that they support it, and to tell, and our council wanted to add it. No, we asked for it to be for Massachusetts, and they wanted to do it for everyone. But I think what I was mentioning was that we would get more mileage out of it if we not just had them send that and it's gone, but we have them join the coalition of more than 100 organizations of different kinds and businesses that are part of the Mass Care Coalition trying to get single payer health care. So the other thing is, though, in our area, I hadn't, what I mentioned was I hadn't been doing very much as a healthcare leader, chair leader here, but the people in my committee this year are very eager to try and tap into the students. We have 5 colleges in the area, so we're making a big push to get students involved.
Thank you. Yeah, so, I mean, it's, in my lifetime, of course, we've seen the rollout of the Affordable Care Act, which was incredibly exciting, but it's still not solving the problem that in Massachusetts we have, still people who are between jobs, who don't have health insurance. And just so you guys know, you can read my testimony from the last session on our website, on the LAC website, where I talk about my own experience accessing healthcare and having trouble accessing it. But I want to invite you all to please join LAC on September 18th. If you want to join us, we have a day on the Hill. It's obviously a beautiful time of year, right after the, everyone comes back to the area for their college or whatever. September 18th, it's a Thursday. We do it once per session. And we are all there, all the different topics, not just healthcare. And our main ask is we ask our folks, our elected representatives, to vote the bills out of joint committee favorably. So I want to cordially invite you to consider coming and joining us, the League of Women Voters of Massachusetts, to do so. And I also want to invite you to all please go to masscare.org to take a look at the daily work that's going on to make this a reality in Massachusetts. So we can also, thank you, Jen. Don't forget to read our monthly action newsletter. I have a couple of public service announcements for the Legislative Action Committee. We are looking for a new legislative specialist. Like I said, I'm with healthcare, but we are looking for somebody to volunteer or to recommend someone to be the natural resources legislative specialist. We are also looking for someone to, at any given time, we're probably looking for someone because everyone's life is complicated. Sometimes people are coming and going. So don't be shy if you want to get involved in LAC. Read and act on our action alerts, which come through, I believe it's the League Leaders web listserv. And if you're not on League Leaders, please try to add yourself or ask somebody to help add you. And then please attend our educational events like you're doing tonight, or remind your friends in your local league to do so, and tell them whether you liked it or whether you thought it was informative. And then, like I said before, we'd love to see you on September 18th at Day on the Hill. And if there aren't any other questions, please go ahead. Oh, Go ahead, Jen, you can show those if you want. Jen is
no,
our
all
fearless
set.
leader, by the way, for WAC. So,
Thanks, Ellen. That was wonderful.
what
Thank
were you
you.
gonna say? Jen, did you want to
Oh, I
show
was just
those
going to
again or
say if
no?
anyone else has any questions. No, that's fine. I'm happy to share the slides to the listserv tomorrow, and everyone registered will share the recording and the slides.
Yeah, that'd be great. I have one more question from Barbara. Go ahead.
If anybody saves the chat, the National League of Women Voters has an interest group, and we work with people all over the country, Washington, Florida, Maine, Vermont, Ohio, and so forth. And we have a toolkit that has a lot of information that and we're trying to make it as even more user friendly than it is. I think it's pretty user friendly. So you're welcome to use that.
Thank you. Thank you. Yes. Clearly, we're not the only state wrestling with this. And thank you, Barbara, for reminding us. One of the articles that I posted earlier is with the national scope. So if you want to just play around with those ideas, it is obviously all over the United States is completely different than Massachusetts. And I can only be an expert on one state, but for example, really quickly, we have expanded Medicare in Massachusetts, which covers more people. And there are many states, I'll give you one example, Florida does not have Medicaid, does not have expanded Medicaid. And therefore, there are people who simply are not covered, even though if they lived in Massachusetts, they would be eligible. So just by virtue of where they live, they have worse access to healthcare for paying for healthcare. So it's a very complex issue. You could spend every day, all day studying it and looking at it and talking to people and being on listservs and on and on and on and on. So that's something I've learned in this role. And I'm not tired yet. I'm maybe a little tired, but I'm not done. So thank you everybody for your interest. And we will do this in our lifetime. I'm positive. It is, just open up any Boston Globe and you'll see the 8 towns that were negatively affected by Steward Healthcare's bankruptcy last year. And, that will take you down another rabbit hole. But tonight, all I'm here to talk about is our bill. And I want to thank you for attending.
Thank you.
Have a great evening.
Bye-bye.
Thank you. Good night.